I think, so just give you like so most drug discovery has happened not in India. For, most of it is
which is okay,
adopted from
right?
the
It's okay to
Western
free ride on what other people learn, yeah.
And the typical way it has happened, and by typical I would say 65% of the drugs, there's a base science was done in some university, usually funded by the NIH or a equivalent body. And then
Which Trump is trying to shut down. Yeah.
yeah, that's a topic for another day.
Yeah.
And then companies pick it up, license the base technology, and then take them through further stages, preclinical and clinical development. And that's been, I would say, the story.
Should India do it? Should the Indian government put money in there, or this is not? This is money waste?
To an extent, it's already happening. So the larger Indian firms, like for example, Sun, Dr. Reddy's, have fairly active development programs going on, and Sun has a couple of clinical candidates.
But Dr. Reddy rediscovers drugs that have already been discovered.
Yeah, that's on the generic side, but
Yeah.
they have a division doing pure discovery research too. And the CSIR has traditionally funded a lot of the biomedical research through institutes like CCMB, based out of Hyderabad.
Right.
And I think there's a lot of promising researchers. And now you see actually companies from the US, the Pfizers and the AstraZeneca, scouring labs in India to see if there's technology that they can in-license. So that's actually happening. And in a way, to answer your question about whether India should do it or not, I think India will do it whether we would like to do it or not. Now, technology doesn't spread based on countries. Like, I used to live in the US. There were like these ivory tower center of excellence, and you drive 30 miles and you would go into an inner city living in a different cultural milieu. And that's the same thing with India, right? There's probably 5 different Indias parallelly coexisting. And I think there's smart researchers who will go ahead with this work irrespective.
Okay. Doctors.
Yeah.
Do we need more doctors or fewer doctors and more doctors' assistants who can use AI and perhaps multiply what one doctor can do?
Okay. No, it's a very interesting question because India is going through this transition. So when I was young, you'd go to a smaller town or village. I think the registered medical RMPs, as they used to call it, there were no doctors, and we had huge understaffing issues from a doctor perspective. It's a fairly well-known issue. But the south and west of India has invested a lot in medical education. So as a result, you're now actually above the WHO recommended limit on doctor to, or suggested ratio of doctor to people. I would say doctors have been really, really busy because, on average, a doctor at Yashoda probably sees somewhere between 50 and 60, with some of them seeing 140 people in a day. So that's clearly not a sustainable clinical load. And we did that because we never had, that kind of talent pool. We didn't have that many number of doctors. I think it will come down, the number of patients that you have to see in a day will come down. The time you spend with the patient will increase. I think the quality of clinical decision making will increase. I'll be very surprised if, through your life experiences, you haven't been in situations where this doctor didn't have time. He looked at you, wrote out a prescription. That will change. He'll spend more time, focusing on your wellness.
But in many cases, maybe the doctor doesn't need to spend time. By the time the patient shows up, maybe the prescription should be ready because they've already looked at all your data.
I would agree, very much with your base thesis that the role of the doctor will change fairly dramatically. But I think the definition of a doctor what's the cycle? It's you fall ill, you go, you talk about a certain symptoms and then they prescribe. I think that's going to go to a different model. I don't know when that is. It's 5, 10, 15 years from now, where more of your biological data will be kind of continuously collected, will be fed into algorithms. But the doctors will be taking critical decisions in ambiguity and also helping people with health and not just with disease. I think that's the transition that I see.
My last is death.
Okay.
Should we embrace death more warmly and go and not stick around for too long? I mean, what do we need to do?
I would say it's a very personal choice. I think I would be on the spectrum of being prepared and embracing the concept of not being here permanently and plan for that. But it's hugely shapes. Like I would say there's a whole spectrum of people with different cultural attitudes to it. So I would personally be more on the embrace the life cycle.
Okay. Thank you very much. Give a big round of applause to really thoughtful answers, Dheeraj. It was a pleasure. And I hope you enjoyed it too. Thank you.
Thank you so much, Professor Bhagwan.